Hello, good afternoon, everyone. Sorry to have kept you waiting for 7 minutes. Welcome to the webinar. My name is Irene Tarigo, and I'm a clinical psychologist at HealthX Africa. So today we're going to be looking into, unpacking depression among men, because there are differences between depression among women and among men in terms of the manifestations, the symptoms, and even the coping mechanisms. So that's what we're going to be looking at. And first of all, I just want to say thank you to everyone who has created time to join me in today's webinar. Should you have any questions, feel free to type them in the chat box, or even just share the questions with us or with me at the end of the presentation. So without further ado, I'll get into the webinar. And before I get into the presentation, I'd like us to just, talk about HealthX, what HealthX does, and the services that we provide. So HealthX is a next generation telemedicine company whereby we provide medical services. We have medical doctors, we have clinical nutritionists, as well as clinical psychologists. And you can access us via voice call, video calls, or even a live chat. We have an integrated mobile app, which is very user-friendly, and it has got different features whereby you get access to primary healthcare consultations. That's every month, and you're able to speak to our team whenever you need, for as often as you need to talk to them, because we operate 24 hours, 7 days a week, and you can reach us, or we can, communicate via video calls, voice calls, or even live chats. So like I said, we also have our clinical nutritionist whom you're able to talk to anytime from Monday to Friday between 8 a.m. and 5 p.m. We do provide very affordable quality healthcare services, and our fees is just 795 shillings per month, whereby you have access, like I said, to the clinical psychologist, medical doctors, or the wellness specialists. So without further ado, let's get into the presentation of the day. And it's important that we try to understand exactly what mental health is. So when we talk of mental health, we are referring to, the state of mental well-being, whereby as an individual, you're able to cope with basically the stresses of life. You're able to realize your abilities, you're able to learn, basically having the cognitive abilities to process information, retain information, and even give out, the output in terms of what you've learned. You're able to work well, perform in terms of your duties, work, career, as well as contribute to the community. So this is according to WHO in a publication that was done in 2021. It's very important to understand that, how we think affects how we feel, that is our emotions, and therefore how we behave. So our thoughts impact our emotions and how we behave. So, for example, anytime you think that you're not capable of carrying out a task or performing in a certain, a task that you're meant to do, it means that this will affect your self-efficacy or your self-confidence, therefore interfere with your ability to actually carry out that task. It's also very important to note that our thought processes have an impact on how we view ourselves. That is our own intrapersonal relationship with ourselves, how we view ourselves, whether it's our self-esteem, our confidence, and so forth. And at the same time, our thought processes affect how we relate with other people and how we view the world in general. So when we talk of depression, what exactly does depression mean? Because I know, there's a lot of talk about people being depressed, or even people diagnosing themselves with depression. But when you talk of clinical depression, what does that entail? So depression can be categorized as either a major depressive episode. And when we talk of episode, we are talking of like a one-off occurrence, which is characterized of symptoms that last for approximately 2 weeks. So that is for the major depressive episode. And then we also have major depressive disorder. And from the word disorder, that means it's something that recurs, it's out of the norm. So what causes depression? So biologically or chemically, depression comes about due to low dopamine levels, or what we refer as neurotransmitters. So anytime you're experiencing, a dip or low levels of dopamine levels, it means that you're predisposed or you're prone to depression, as well as other mental health illnesses such as schizophrenia, Parkinson's disease, among others. Research has also, found that globally, there is an estimated 264 million people who are affected by depression. I mean, that's a huge, huge number if you were to just look at it critically. It's also very important to note that depression is the leading cause of most suicide acts. So anytime we hear that somebody has died by suicide, it means that in most of the cases, it's usually because of depression. So depression is one of the leading causes of suicide. And that is also important to note. Another fact is that for every suicide case, there are many more people who attempt the same. So meaning with every successful suicide act, anytime somebody takes their life by suicide, there are many, many more other people who actually attempt to take their lives at the same time. Also of importance to note is that a prior suicide attempt is the single most important risk factor for suicide in the general population. This means that anytime somebody attempts suicide, basically just from what the slide says, a prior suicide attempt is the single most important risk factor for suicide. Meaning anytime somebody attempts suicide, it means that there's a high likelihood they will actually attempt the suicide again, and in some circumstances actually take their own life or die by suicide. So anytime there's an attempt, which means there's a higher risk of the same happening in future, or even the person actually ending their life by suicide. So that should not be taken lightly, because I know there are people who say, people who threaten that they'll, take their life by suicide, or that they will die by suicide. It's just a bluff, they're not serious. But it's important to note that any attempt, any prior attempt is a big risk factor for suicide in future. So we've spoken of major depressive episode, and what does this entail? So according to the DSM, which is a diagnostic tool of mental disorders, in order to clinically diagnose depression, 5 of the following symptoms need to be present for at least a 2-week period. So meaning that for 2 weeks, that is continuously, every single day of the week, there has to be a minimum of the following 5 symptoms. And these symptoms need to affect one's functioning. Meaning that if you have at least 5 of these symptoms for the same 2-week period, usually there's impairment in functioning, and we will see what that impairment means. And one of the symptoms either has got to be a depressed mood. By a depressed mood, we mean low mood, feeling like, you're not happy, you're sad, but then in terms of your mood, you're generally quite low. That's one of the symptoms that should be there within the 2-week period. The other symptom is loss of interest or pleasure in previously enjoyed activities, meaning if you like watching football, meeting with friends, or participating in any activity that you normally do, usually there's the loss of interest in pleasure or previously enjoyed activities. The other symptom is depressed mood most of the day, and this is characterized by feelings of sadness or emptiness. So you find that for the most part of the day, you're feeling quite sad, you're empty, you're feeling, hopeless as well. Like I've said, there's also diminished interest or pleasure in previously enjoyed activities. So you find that you've lost interest in things that you used to enjoy doing. That's the other symptom. Major depressive episode or clinical depression is also characterized by insomnia. Insomnia refers to lack of sleep or hypersomnia. So it could either be that you find that you're lacking sleep or you're sleeping too much. And this lack of sleep or sleeping too much takes place nearly every single day. So out of the 7 days, you find that most times you're actually experiencing insomnia, lack of sleep, or sleeping too much. The other symptom is fatigue or loss of energy every day. By loss of energy, we mean that, even if perhaps you've slept at night, you tend to wake up feeling very tired, not rested, or generally just lacking energy to carry out your mundane activities. It could be even lacking energy to brush your teeth, to comb your hair, things that are very, very easy to do otherwise, or would be easy to do under normal circumstances. The other symptom would be feeling of worthlessness. And these are symptoms that are very important to make note of, so that anytime you feel like, you're experiencing any of these symptoms for 2 week or for a 2 week period or for 2 weeks continuously, then you're able to pick out what the feelings are, the symptoms are, and get the necessary help. So the other symptom is feeling of worthlessness, whereby you feel like you're not, deserving of anything, you're empty, you're feeling hopeless. There's also diminished ability to think or concentrate or indecisiveness, meaning if you're taking part in an activity, either you're reading or you're watching a movie or watching TV, you're unable to concentrate. Sometimes you find it hard to even think, or to make a decision. Basic things like, just basic decisions that would be so easy to make tend to be quite difficult to make when somebody is clinically depressed. Because you say that depression is one of the leading causes of suicide, or it's a risk factor, you find that with depression or with clinical depression, there are recurrent thoughts of death. This means that anytime, a person has got all the, the recurrent thoughts of wanting to die, wanting to end their lives, or just wanting to not be alive, it means this could be a key indicator of clinical depression. So with clinical depression, there are recurrent thoughts of death, whereby there's a lot of preoccupation with not being alive. And usually the idea is not even to be dead or to die, but just to get away from the pain and the feelings of emptiness and hopelessness. Right. So the other key indicator of clinical depression is that usually there's significant impairment in functioning. When we talk of functioning, we mean, for example, social functioning, whereby, yes, you have all the symptoms, but then the symptoms are so severe such that there's impairment in social functioning, whereby you don't feel like meeting up with people. And that's why you find that somebody who's clinically depressed, they tend to self-isolate. They want to either just be in their room on their own, be at home, not socialize, or not interact with other people. So the other area of impairment is occupational. This means that their work is affected because they've got low energy, they're unable to concentrate, or they don't have the motivation to even go to work because there's a feeling of hopelessness, worthlessness, and so forth. There are other important areas of functioning which are affected, and this could also be financial in the sense that it could be that the person is either, spending too much money or indulging in activities that they otherwise would not be indulging in were they not depressed. So because we are looking at, male depression or depression among men, it's important to look at, things that surround depression among the male population. And one of them is stigma. So male stigma surrounding depression and why they do not seek help, or why men tend not to seek help when they are depressed or when there's depression. So mental stigma describes a process that involves either labeling, so there could be labeling of, the condition, stereotyping, for example, saying that, anyone who's depressed is weak, they don't have resilience. There's also separation when there's stigma, because there's that sense of discrimination, loss of status, and discrimination in general. So there are two types of stigma when it comes to male depression. One is public stigma, whereby, this is characterized by stereotypes. For example, men who are depressed are weak, they're not strong enough, they're not resilient, they don't know how to toughen up, and so forth. And all this is just myths. There's also prejudice and there's discrimination among members of the general public. So basically, the society as a whole tends to stigmatize male depression or men who suffer from depression. So like I said, for example, there are labels such as all men depression are weak and unmanly. So we have public stigma. The other form of stigma is what we call self-stigmatization. Now, this is whereby mental illness, so for example, people tend to agree that mental illness is, so there are negative stereotypes whereby the person stigmatizes themselves and they turn against themselves. For example, I am a man with depression and therefore I need help. So that means I'm weak. The fact that I'm a man and I've got depression, it means that there's something wrong with me. So that is self-stigmatization, whereby, you turn all these negative connotations towards yourself. And then there are critical issues when we look at men's mental health. So there are things that are very important to note, when it comes to the mental health of men. And one of them is depression. And it is important to note that epidemiological research shows that the incidences of unipolar depression in men is half that for women. Unipolar depression, because we have different mental health conditions. We have bipolar. Bipolar means there's the aspect of the high mood and then the low mood. So depression from the word depressed. So there's the depression, the depressed mood in bipolar, and then there's the elevated mood. But we find that in men, unipolar depression, that is just depression without bipolar, the incidences or the prevalence or the occurrence is half that of women. And the reasons for this could be, one, it's very possible that men are simply less likely to experience depression for unclear reasons. Biologically, genetically, that is one of the theories, that men are less likely to experience depression for unexplained reasons. The other explanation for this as to why incidences of unipolar depression among men is half of that of women is because that men are reluctant to acknowledge depressive symptoms because of male socialization, because of how many boys, when they're young, how they're raised and how they're socialized to learn to be tough, not to cry whenever they get hurt. So basically that aspect of socialization causes men as they grow up not to acknowledge any depressive symptoms because men are expected to be tough, to be masculine, and to have it all together. The other explanation is that men experience depression in a much more different way or a specific way compared to women. Meaning, if you're looking at the standard operational criteria, that if you're looking at it from the clinical diagnosis, men do not externalize symptoms, for example, crying and talking about it. But on the other hand, they tend to internalize symptoms that they go through. And the internalization of symptoms is not valid in a male population. By internalizing, it means that they tend to keep all these negative symptoms they're going through within themselves. And then, the depression manifests in other ways compared to women who would cry, they would talk about it, they would vent, men would keep it inside. So the other critical issue when it comes to men's mental health is substance abuse. And that's the other key difference. So alcohol has the greatest impact upon mental health across compared to all other substances. So compared to marijuana, compared to heroin, cocaine, and other substances, you find that alcohol has the greatest impact on men's mental health. It's also important to note that men are 2 or 3 times more likely than women to have a serious alcohol use problem. So there was a study that was done in 2012 of men's mental health in Canada, so men's mental health and substance abuse, and it was found that males had higher rates of substance use disorders in the last 1 year or 12 months compared to women. That is, there was 6.4 times, or men was 6.4 times higher in rate compared to 2.5% of females who reported symptoms that were consistent with substance use disorder. So when it comes to the male depressive symptom, the presentation might manifest differently. So it has been theorized that there might exist a form of depression that has remained absent from the international diagnostic criteria, meaning, the diagnostic tool that psychologists use to diagnose depression. When it comes to men, these symptoms which are in that manual are not present, and therefore that's where the male depressive syndrome comes, because the symptoms are not classic according to the manual. That's the DSM. So the male depressive symptom or syndrome is characterized by sudden and periodic moments of irritability, anger attacks, aggressive behavior, and so forth. So what this means is, compared to women, or compared to the classic symptoms of depression, such as isolation, crying, talking, venting, low mood, and all that. With men, it might come out as feelings of being irritable, bouts of anger, and aggressive behavior. So it wouldn't be so easy to pick out and say that this man is depressed, because for men, the manifestation is different compared to that of women. Then we can also look at depression and gender differences. So gender amalgamation, also there are a number of factors that bring about these differences. One of them could be biological factors, cultural factors, like we've seen, the socialization culture plays a part in how depression manifests between men and women, historical factors, psychological factors, as well as social factors. Although the word is often used deliberately to exclude biological factors. And then it's important to understand what sex means, and sex refers to the biological factors that differentiate male and female. And sex differences are, basically those factors: biological, cultural, social as well. Gender differences, or gender, refers to social aspects and cultural meaning associated with behavior, personality expressions, conventionally labeled as feminine, either feminine or masculine. So those are the social differences when it comes to gender. Women exceed men in internalizing depression, as we had discussed, and other mental health conditions, while men externalize, like we said. So for women, they would internalize, they would either internalize the symptoms, either crying, talking, venting, and so forth. While for men, they externalize through behavior such as substance abuse and antisocial behaviors such as aggression towards others, lying, vandalism, and risk-taking behaviors. So it's very important to note this, because, for men, it's not usual that you'd find a man crying, or they might talk, but the manifestation of depressive symptoms when it comes to men is totally different from women. That's why it's important to know these symptoms, so that you're able to pick out and understand, is it that the man is depressed, the irritability, the bouts of anger, the substance abuse, rather than just, label them as reckless or alcoholic and so forth. Compared to women, drugs and alcohol interfere with their lives more often. So compared to women, you find that when it comes to men, drugs and alcohol are they are the major factors that interfere with their lives, hence causing problems at work, in school, or even in their families. So these symptoms, the internalizing or externalizing, when it comes to men, the externalizing symptoms are theorized to reflect the behavioral manifestation of depression among men who rigidly conform to the masculine norms, either being a real man, big boys don't cry, and so forth. So this irritability, the bouts of anger, the violence, the drinking, these are manifestations of the social norms or the stigma towards men. So despite the greater prevalence of depression in women, there are 3 important reasons for exploring depression among men. One of them is that men are numerically a minority group when it comes to receiving a diagnosis, treatment, and even treatment of depression, meaning that if you look at the clinical setup or when it comes to healthcare services, diagnosis of depression is much more higher in women compared to men. So that is one of the explanations. However, community surveys of men and their mental health issues, for example, suicide and alcoholism, have led some to suggest that many more men have depression than are currently seen in healthcare services. And one of the reasons why diagnosis of men with depression in the healthcare facilities is not that high is because of one, the stigma, that is the public stigma, or two, even the self-stigma, because of perhaps the notion that, how will I be looked at if I disclose that, I'm low, I'm sad, I think I'm depressed. I mean, how will that be perceived? So that could be one of the explanations as to why diagnosis of depression among men is much less compared to women. So why do men hesitate to seek help? And how can we challenge masculine norms, the norms that we've talked about? For example, big boys don't cry, a man should man up, toughen up, and not seek help. So one of the reasons why men hesitate to seek help is because of the attitude towards depression. You find that masculine norms influence men's attitudes towards depression, as well as their decision to seek help. So those norms of a man should be tough, that definitely impacts or prevents men from seeking help. You find that because of socialization also, men tend to trivialize their symptoms. For example, this low mood that I'm experiencing, it's just temporary, it will go away, it's not a big deal. So there's a lot of minimization or trivializing of the symptoms of depression. And then you find that these symptoms are expected to return quickly, or rather the person expects that they would return to a normal state quickly. So they minimize and, they just put it down to, it's just a temporary feeling, I'll be okay by tomorrow. Also, you find that why men hesitate to seek help is because men's socialization in general has an emphasis on avoiding feelings, appearing strong, and never crying. So all this is because of socialization and stigma in society. Yeah, so there's a lot of emphasis on, men don't talk about their feelings, keep it together. It's unmanly to share your feelings, to be emotional, and to say how you feel. And men are also expected to appear strong or having it together and not to cry. That's why you find that when children, are being raised or when they're growing up, they're told, don't cry, you're a boy, you're a big boy, keep it together, which is not the right attitude. The other reason why men tend not to seek help when it comes to depression is because of the perception of societal views on depression. You find that gender-related stigma experiences can be classified into two categories. That is, stigma related to depression between the two genders are categorized one being, being assessed as incapable. That is, the man is being assessed of being incapable to adequately cope with mental distress. So the society or the societal view is that a man who, shares their feelings, their emotions, or seems to be not strong enough, it means that they are not able to adequately cope with mental distress and that they're weak. So that's one, that's the other reason why men don't seek help for depression or depressive symptoms. The other reason is that depressive symptoms were not taken seriously by others who believe that mental disorders are as a result of inability to deal with distress. Basically, this means that people or men who have depressive symptoms or who display, such symptoms are unable to cope with distress. So that basically points towards stigma again. Secondly, stigma experiences were related to the failure to fulfill norms or are related to failure to fulfill norms relating to work. There are tendencies, for men to be shunned either by their workmates, even at work. Should they display symptoms of depression or should they indicate being depressed or being low? So there's a lot of shunning by either their workmates and the management because they're unable to cope with mental health problems. So there was a study that was done, and one of the participants, a male participant of the study, reported that, at work, when he said that he had suffered depression, the perception was that, people at work said he didn't appear to be sick and that, they had never been sick in their lives. So basically they were castigating him or putting him down, not really castigating, but then putting him down and telling him that, why would you say that you're depressed, yet you look okay, you seem to have it together? And the analysis revealed that not being sick at work was associated with attributes of being strong. So keeping it together, holding it in, and toughening it out was associated with the man being strong, successful, and self-reliant. And this was conveyed by the employment environment. So anytime the man seemed to have it together, showed up to work and was okay, then he was seen as strong, self-reliant by the work environment. Whereas if they displayed any indication of being depressed, there was a lot of stigma to that. So in contrast, mental health problems in the workplace left, the participants of that study feeling weak and vulnerable. Therefore, they reported that their depression-related incapacity to work made them feel stigmatized by other colleagues. Right? So it means that compared to the other scenario, in this case, the mental health problems in the workplace, it actually left those participants feeling weak and vulnerable because of the stigma, the perception that they were not strong enough and they were not self-reliant. Yeah, so in some cases, they're actually labeled as losers, lazy, or incapable of even carrying out the task. Right, so we've seen, or we have looked at the critical issues surrounding men and depression among men. And one of them, because we've seen the externalizing of behavior, meaning compared to women who cry, they vent, they talk, men tend to abuse substances. So when it comes to the critical issue of drugs and substance abuse, you find that the effect of alcohol, because we've seen that alcohol has a bigger impact on men compared to women. And how that happens is because alcohol is a depressant. So for somebody who suffers from depression, you find that copious amounts of alcohol they depress the nervous system. Other substances of abuse, such as marijuana, also depress the nervous system. So it also, or rather, depresses the system. So you find that it's actually counterproductive because I know for some people who are dealing with depression, they cope by drinking alcohol because they feel or they think it will help them feel better. In the short term, yes, because small amounts of alcohol is a stimulant. So alcohol consumed in low amounts stimulates the nervous system, makes you feel good, upbeat, and happy. But then copious amount or large amounts actually depresses the nervous system. So it makes the depressive symptoms worse. And how they do this is because alcohol depresses, or rather it slows down parts of the brain and results in impaired cognitive functioning. For example, poor judgment, making bad decisions, such as reckless driving, unhealthy sexual habits, among others, and also leads to depression symptoms. So it's inevitable that, because we've seen that depression is one of the biggest risk factors for suicide. So it's important to also look at suicide among the male population. You find that suicide refers to death caused by injuring oneself with the intent to die. So in most suicidal cases, you find that the actual intent is to die compared to the stigma that is there, because there's this notion that, people who threaten to take their life by suicide are just seeking for attention, right? So usually in most cases, the intention here is to die rather than manipulation or trying to get attention. So that is what suicide refers to. Yeah. So it's the intent to die through taking one's own life. And then we have completed suicide, and completed suicide refers to the deliberate act of killing oneself or taking away one's life using a method that one knows will result in death, or basically actual death. So completed suicide means, taking one's life using a lethal means. So using a means that is lethal enough or severe enough to actually complete the task. And then we have attempted suicide. So attempted suicide, from the word attempt, refers to the deliberate and intentional act of self-injury using a method that is intended to result in death, but fails to result in death. So for example, somebody perhaps uses a means that does not actually lead to death, but there's that possibility that, death might happen, but then it's not actually a completed suicide. And then we have para-suicide. Para-suicide refers to repetitive acts of deliberately injuring oneself using non-fatal means that does not result in death. For example, self-mutilation or non-lethal drug overdose. So an example of para-suicide could be self-cutting. You find that for people who are depressed, some people who are depressed, or a number of people who are depressed, because of the pain that they experience within themselves, because there's a lot of pain, emotional pain, feelings of hopelessness, worthlessness, and just lack of a reason to go on living. So they tend to, the intention is not really to die, but then to ease the pain that they're suffering inside. So what they do is that they self-mutilate, so they would use a means to just harm themselves without me going into details of how that is done. But then, so they use several means to just mutilate themselves in an attempt to ease the pain that they experience inside. And they report that when they do that, they experience a form of emotional release. But we do know that this is not healthy because it can actually lead to death. But usually in para-suicide, their intention is not really to die, but to ease the pain. And then we have suicidal behavior. So suicidal behavior refers to a spectrum of self-destructive behaviors consisting of fleeting wishes to die, or suicidal feelings that are coupled with or without the communication of suicide intent, the making of suicide note, for example, or making a plan, attempting suicide, and even completed suicide. So basically, it means that suicidal behaviors intends things like writing, like a death note, indicating, the plan to die, or even communicating an intention to die. So this means the person could be verbalizing the intention to die. So they might, keep repetitively saying, I wish I was not around. Perhaps life would be much easier without me here, or I wouldn't be in so much pain. And there's also the spectrum of destructive, self-destructive behaviors with the intention to die. So, for example, reckless driving or taking part in activities that might result in death. We also find that many suicides tend to happen at very impulsive moments. So this means that for most people who actually complete suicide, it's usually in a moment of crisis. So in most cases, yes, the thoughts have been there, but then in a moment of crisis, without any coping mechanism, without any support, that's when the person just, gets triggered, and because they feel hopeless and they have no way out, then they tend to take their life by suicide. So it's during these moments of crisis whereby there's a breakdown in the inability to deal with life stresses, either financial problems, relational problems, or even health reasons, for example, chronic pain and illnesses. So during such moments of such crisis that we have described, either financial and so forth, that's when people who have been depressed or who have expressed suicidal ideations or intentions in the past actually take their lives. So it's usually in that moment of crisis. That's why it's very important, whenever somebody is in a moment of crisis, especially if they know they've suffered depression or they are suffering depression, or if you know of a loved one who suffers depression, it's very important to always reach out for help, seek help, and, get help in general, to avoid taking one's own life. Suicide has been described as the silent epidemic, and the reason for it is because there is low public awareness regarding the magnitude of this problem, that is suicide itself. And there's also very little research and very few preventative efforts specifically targeting male suicide. So among the male population, what this means is that among the male population, suicide is one of the silent epidemics because of the low public awareness when it comes to the magnitude of depression itself, because that's a risk factor for suicide. So one, there's very little awareness when it comes to male depression. So that the awareness is lacking, number one. Number two, there is little diagnosis compared to women. The diagnosis of depression is much less. One, because of the self-stigma, as we've seen. Two, because of public stigma. So because of that, we find that suicide is actually a silent epidemic because of all these reasons. So it's also important that, preventative measures or efforts are put in place specifically targeting male suicide. And this goes back, or this goes further or deeper into the diagnosis, normalizing depression among men, and even normalizing mental health conditions among men to avoid the suicide or depression being the silent epidemic among the male population. Furthermore, men, the other reason for this being, suicide being a silent epidemic among the male population is because men are reluctant to seek help for suicidality. Meaning, anytime a man has got suicidal thoughts or they're thinking of taking their own lives, they are reluctant to seek help. And the common reason for that is because of the stigma. Why do you want to take your life? Are you not man enough? Can you not, handle your problems? And that's a very wrong notion. So you find that because of that stigma, there's a lot of reluctance by men to actually seek help for suicidal thoughts. So instead of seeking help, it's either, they internalize it or they actually complete the task. Whereas you find that for women, it's much more easier for them to reach out and to say, hey, I think I'm depressed or I'm feeling so low and I'm thinking of taking my own life. So it's much easier for women to speak up compared to women, which is very unfortunate. And it's also an epidemic, that is, suicide is also an epidemic among the male population because of the high incidences and because it is a major contributor to men's mortality. Meaning you find that between the ages of 15 and 44 years of age, suicide is among the top 3 sources of men's mortality. So suicide is one of the reasons or the leading causes of death among men between this age bracket of 15 and 44. And that is why it is known as an epidemic and a silent one at that. So what are the risk factors for suicide? One, having a mental disorder, for example, depression, or even alcohol use disorder. That's a risk factor for suicide. So it's important that should anyone be experiencing these symptoms, the depressive symptoms that we've discussed, or should they know of anyone, or should you know of anyone who's got such symptoms, it's very important to get them help or reach out for help if you're suffering from depression, as well as alcohol use disorder. Because with alcohol use disorder, there's usually the feeling of hopelessness. I mean, with addiction, in some cases, there's the feeling of hopelessness. So that's a risk factor for suicide. And as we've seen, suicide usually happens in a momentarily or in a moment of crisis. So during that moment where somebody is going through a crisis and then they're intoxicated, there's a high likelihood that they might attempt to take their life by suicide. So as we have seen, by far, the strongest risk factor for suicide is a previous suicide attempt. What this means is that somebody having attempted suicide in the past means there's a high likelihood that they will actually end up dying by suicide rather than by an illness or a road accident. That's why it's very important that if you know of anyone who's ever attempted suicide or had suicidal thoughts, try to get them the right help. So the other risk factor for suicide is having easy access to the means of suicide. So if anyone is, severely depressed, because we have different categories of depression, we have mild, moderate, and severe. So if anyone is severely depressed and they have easy access to a means of suicide, for example, different means, without going into details, it means they are at a risk of actually ending their life by suicide. Another risk factor is difficulties in accessing healthcare when in need. So let's say, for example, in a moment of crisis, and one is not able to reach a healthcare facility, it means that there's a high chance that they will actually end their life. That's why it's very important to have a support system and people who can actually get you the necessary help when you need it. There's also stigma, which is a risk factor towards suicide. So there is stigma towards people who seek help for mental illnesses, substance abuse, and suicidal behavior. So stigma is another risk factor for suicide because you find that the person with suicidal thoughts tends to shun or to keep their concerns or the distress to themselves. So what should we look out for when we, if you have feeling that somebody intends to take their life by suicide? So one of the warning signs of suicide is talking about suicide. I know in our African society, there's this notion that somebody who keeps talking of suicide or wanting to take their life by suicide is just seeking for attention, or they're just bluffing, they're not serious. But it's important to note that anyone who talks of suicide, there's a high possibility that they might end up attempting to take their life by suicide. Another warning sign is seeking out lethal means, meaning if somebody intends to die by suicide and they actually seek a means so severe, so lethal, such as, we can think of lethal means, it means they're actually serious about ending their lives. Also, preoccupation with death, meaning the preoccupation with the idea that perhaps if I was not alive, people's lives would be easier. Perhaps if I was not alive, I would not be in so much pain. Preoccupation of not being in this world. All these are warning signs of suicide. Feelings of hopelessness, as we've seen, this is one of the symptoms of clinical depression. Self-hatred, self-loathing, and also isolation or withdrawing from others. This is the other sign. Self-destructive behavior, like we've seen, for example, self-mutilating or cutting oneself. A sudden sense of calm, meaning if somebody used to talk about ending their lives, or for example, let's say they were so distressed about a particular thing, and then all of a sudden they have this eerie sense of calmness around them. They're no longer talking about the issue. They're not sad. They're not happy. They're just there. It's like they're just there. It means this could be a risk factor for suicide because it's like they've made peace. They've come to a certain conclusion. Another risk factor, another sign of suicidal intent is getting one's affairs in order. So, for example, if somebody is still young, not in the retirement age, has an active family life, basically seems like they have their life together, and then suddenly they start getting everything in orders, putting things in place. This could be another indication of suicidal thoughts or ideations. Even intentionally saying goodbye, intentionally telling people goodbye, your friends, your loved ones, making peace with people, that could be another sign. It doesn't mean that it is, but it could be something to look out for and to try and understand why is the person doing all these things. So how do we prevent suicide? So what are the tips that we can use? It's important to speak up. Should you be having these suicidal thoughts? We've seen the stigma surrounding depression among men, but it's very important that you're able to speak up and ask for help. Reach out to people that you trust, your loved ones, and the healthcare profession or the healthcare providers. Get professional help, speak to a therapist. Like we've said, you can call HealthX because we have, there's the issue of privacy, confidentiality, and also being able to speak to us at the comfort of your home. So try and seek help. Follow up with treatment. So if you feel like you've got this, that you're suffering depressive symptoms, seek out for help, go for treatment, get help. Having a support system is very important. It could be one person that you really, really trust, or just your close family or friends. So if you're a support system, then how would you help somebody who has suicidal thoughts? One, respond quickly. Should somebody actually say that they intend to die by suicide, do not take it lightly. Do not, make the assumption that they're trying to get attention. So respond quickly, offer support, and ensure that they are safe. I will quickly run through the rest of the slide. So how do we deal with depression and suicidal thoughts? Self-awareness, be self-aware. Accept that whether you're a man or a woman, it's okay to not be okay. We are human beings, we are bound to go through emotions and challenges in life. So accept that it's okay to not be okay. We've said having a trusted support system is very, very important because when somebody is severely depressed, it means their judgment is impaired. So if you have a support system, they're able to reach out, they're able to give you the necessary help, whether it's your family, your friends, or even your trusted co-workers. Self-care is very important. For example, engaging in sports, because sports and physical exercises, they lead to, the feel-good hormones, endorphins, and that will improve your mood, elevate your dopamine levels, and just your overall well-being. Reading, exercises, getting adequate sleep or rest, and even mindfulness. Journaling is also very important because you get to put your thoughts, emotions, and feelings on paper, and that gives you what we call catharsis or a feeling of relief. Seek therapy services or counseling because you're able to be properly assessed and treated. So how does having a healthy mental state help? It means that when you're healthy mentally, it means you're able to cope with the stresses of life. So regardless of whether you've suffered from depression, seeking professional help or talking to a therapist means you're able to cope with stresses at work or even in your personal life. When you have a mental healthy state, you're able to be productive, contribute to your community, and the overall growth of the society or the development of yourself or the society. When you have a healthy mental state, also, you're able to fully realize your potential and even achieve a sense of purpose or be fulfilled. So there are several interventions, and one of them is the gender role theory. So it's important that services are redesigned to target masculine, problem-focused individuals. So it's important that even in the healthcare systems and policies that are being put in place, that these services are designed to, target the male population and even people who are able to bring these changes, positive changes, whether individuals, community, or the society as a whole. So another form of intervention is that services could adopt practices to help men with depression to challenge gender role norms, which would theoretically leave them better able to recognize and accept help for their own depression. This means that so we at the end of the slide we'll have a mental health tool whereby you're able to assess your own mental health when it comes to depression and other mental health conditions, and then you can reach out to health techs. Right, so challenging these gender male roles means people who've gone through depression, who've lived with depression and have successfully, lived out their lives, their careers, their family lives, their personal lives, them coming out and speaking out would actually be of positive influence to other males who've gone through the same or who have suffered depression. So there's also a suggestion of detaching oneself from. So it's very important that we detach, the notion or the traditional masculine norm, which prevents men from seeking help or getting help for being depressed. For example, it's important to challenge masculine norms such as this kind of thing of I cannot show weakness, I cannot be sick. So these norms should be challenged and avoided. And that's why we say that it's okay to not be okay. It's okay to say, hey, I'm a man, I've gone through this or I'm feeling this way and I am not okay. Right. So we have different assessment tools for depression. One of them is the male depressive scale, and we also have the Beck's depression inventory. So these tools actually help you to assess the level of depression because, like I said, we have different severities. We have mild depression, we have moderate, and then we also have severe depression. So I can see that we are out of time, but we do have an assessment tool which you can access on the chat box. As HealthX, we have got different assessment tools. So with these tools means you're able to assess yourself for different conditions such as depression, trauma, substance use, and even anxiety. So once you do the self-assessment, then you can reach out to us by calling our toll-free number and then, speaking to a therapist or a healthcare provider. And that marks the end of my presentation. I am open for questions, comments, clarifications, should there be any. And I hope you can see the tool on the right side of the chat box. Yes, so thank you so much, Harold. Yes, I will share the presentation. I believe I've got your email addresses. Yeah, so I will share I will share the presentation and the recording with you to your email addresses. So I will do that. Thank you so much, Harold. Any other questions? Right, so we would also appreciate you giving us feedback on the webinar. And how you get to give the feedback is you click on the link that's on the right and just give us any input and any thoughts that you have regarding the webinar. And also you can share, if you have any topics that you feel would be relevant to you, if you'd like us to cover any topics, feel free to give us that feedback and we will gladly have webinars on those topics. You can also follow us on our social media pages. That's on Twitter, Facebook, Instagram, and even on LinkedIn. And you can call us on our toll-free number. This means that when you call this number, you will not be charged for airtime. You just call and talk to the psychologist, the nutritionist, and even the medical doctors for free. And the number is 0800 720 795. Okay, so if there are no questions, no further comments, then that marks the end of our webinar. I just want to thank you all for making time to attend the webinar today. My apologies, it took the whole duration of the webinar session, but I will share the presentation with you, and then should you want to reach out, you're free to reach out to myself or any of our colleagues, the other psychologists, and we will gladly be of help to you. So thank you so much. That marks the end of our webinar, and we look forward to having you attend our other webinars in future. Thank you, and I'll be ending the webinar now. Thank you so much for your attention and for making time to be part of this webinar today. Thank you.